Hi, everyone. Good evening. Thank you so much for attending. My name is Alex Preissig. I am the Clinical Sciences Representative on the Alumni Council, and tonight's session is Career Leadership and Mentorship, hosted by Dr. Nick Paslidis, an alumnus of RUSM who graduated in 1988. This session today is part of the Alumni Council series Rounds with the Council, in which once a month, members of the Alumni Council will speak to current students and give them their insights and help them better their careers. And so without further ado, I take it over to Dr. Paslidis. Go right ahead.
Yep. Thank you, Alex. Appreciate for everybody taking the time after I'm sure a busy day. It's kind of late in the East Coast and almost late in the West Coast. But anyway, I'd like to welcome all of you. Congratulations at your stage of training. I'm not going to spend any time telling you who I am. You can look it up at LinkedIn. Anyway, I graduated back many years ago, 88. And I'll just give you the next 30 minutes, a little the advices, which I'm glad that Alex is recording that. So, how to do, what you're going to do, and then we can have open questions if anybody has questions regarding, what's in your mind and how can I help as a graduate mentor and thank God, a successful career, frankly. But again, it's just me. All right. So next slide. All right. It's pretty well delineated here, the eight dimensions of wellness. And, you know, the main thing here is all of them are important, frankly, in your career, wherever you are right now, because there's going to be a lot of looking in who you are. And you have to answer this. I mean, that's why I put it in the slides. You have to answer those things as you think through and you talk to, your family, other colleagues, because again, nothing happens by accident. You have to work for it. You got to make decisions, what you want to be, who you are, and why. All right, so those are the eight dimensions of wellness you can look at, and to be candid again, the sky is the limit. Sometimes we all think we're, how can I say, underdog in different situations, but uh, the main thing you got to remember, and there is some cliches that I use from my experience, and I say this to anybody who's underdog or high school kids that don't have the best opportunity, to get an education or the money or whatever it is. The main thing is, are you willing to pay the price? Remember that now. Are you willing to pay the price? All right, next slide. So the two most important dimensions, it's yourself, as the slide here says. Passion. What is your passion? Um, who are you as an individual? I know that's what you want to do, medical education, become a physician, be successful. Um, and and you will get there, frankly, with determination and commitment. And you all have that. That's where you are, I think, the third and fourth year. Um, anyway, but again, another cliche that you got to remember, the professor said actually without showing up here at Harvard, what one knows, one sees. Let's take this as a little bit more, because basically you look at dermatological problem. Well, have you had experience? What is your knowledge? How do you recognize certain rashes? If you've never seen it, you don't have the knowledge, you will never be able to do the differential or the diagnosis or the treatment, as you all know. So basically, that's an important concept to remember. What one knows, one sees. Then the other thing that is very important to mention is your community, uh, who you will serve. Once you finish medical school, do you know where you're going to go? How you're going to go? What are you passionate again? Why? What are the needs that you want to meet, or have they been met? Um, a lot of us we claim, and I'm telling you, I'm in a couple admissions medical schools here in Arizona. People say one thing and they do exactly the opposite. So, do you want to serve underprivileged and underserved? Do you want to be in rural areas versus the big cities? And how are you going to get there? I'll give you some hints what you have to do because again, one of the things that I didn't think of, uh, you have to have a strategic plan where you're going to go, what you're going to do with your career and life. Um, I mean, right now the biggest thing is to focus on your next exam, next rotation, but that's not the only thing. You have to think about what do I have to do to be successful to reach my dream. I can tell you, every time I did a rotation, I was really excited by the rotation. Um, so why you? What will make a difference on attendings or a different individuals that control maybe a letter of reference, your grades, um, outside taking the exams. So you see what I'm saying? You have to have a plan of action and you have to sit back and write that stuff. I do this thing to be canon, as I said, and I wrote this in multiple times. I I have to plan out and I'm sure some of you probably do it every Sunday night. If I'm now on call, I plan out everything that I got to do the following week and maybe even the week after, but definitely the following week. Where I'm going to talk to you about certain things, where I'm going to approach, and we'll go into this a little more because we already got 10 minutes down. Next slide. Oh, well, I'll pass this because you can read it yourself. Next slide, Alex. And this is a good, actually, The Metamorphosis by Kafka. uh, Great philosophy and reality. Well started medical school, as you see, very clean cut. You got to, do grades. You got to do volunteer. You got to do the MCAT. You got to do the interviews, Um, so those are all clean cut, as you see in a very delineate on the left, lower. But then again, later on in life, you go into somewhere in the middle, you're entering your clinicals, whether it's, third, fourth year, or even further than that. And you see it's a little bit more not clear, what you're going to do. The influence of different individuals during your clinicals. And I just mentioned that, for me, everything was just great. OBGYN versus orthopedic versus, internal medicine, all the specialties. It depends who you rotate with and how committed you are, right? So you got to be committed. You got to shine. And shine is not cutting corners, frankly. All right. So that's one thing. Not that you guys do. I'm just saying, to give an example for me, I wanted, when I did a surgical rotation as an example, I showed up before the interns and residents as a medical student. I took notes. Now this is different, of course. There's all computerized records, but still, I volunteer for everything there was when they needed some help in the OR. Read articles, approached the faculty so everybody can be impressed how committed and enthusiastic I was. And then I went back at 10 o'clock at night only to get up again the next morning at 4 o'clock trying to do this again. Why is that? Because I wanted to get a surgical specialty. And how will I shine in comparison to others? That's kind of the thing that you guys might think, how do I set this thing up? Because things don't happen by accident. You got to prepare, you got to plan. And then the last thing, as you see here, is when you apply to your specialty or fellowship, it's even less clear sometimes because, again, it's a primary care versus subspecialty. The subspecialties have a second subspecialty. It never ends, basically. But again, you remember, what one knows, one sees. So I want to enthusiastically, kind of encourage you, plan it out, write it out, not just, you know, whatever happens, happens. Next slide. And then again, if it's not just who you are, it's why you are. David Lapin, it's another philosopher. And again, this is reality too. It's not just hypothetical and so on. I mean, that's why we discussed this thing today to give you that insight. And, what rewards me as I grow? Is it knowledge? How much knowledge do I get? You're never going to have enough, actually, to be honest with you. You just do the best you can do and move on. Caring, empathy for your patients, commitment to the patients. We'll all say that, but again, how do you demonstrate the caring and the empathy? When you do something extra, not whatever is the standard of care. I'm in different committees in Blue Cross Blue Shield and other entities, and they say, well, they met the standard of care. Well, it's not just the standard of care. If somebody um, gets in trouble and it's your patient, did you go out of your way to help out? You can't help everybody, but you can try. And that's what will make you, each one of you, above the average. Um, Service. How important is that? Does that reward you that? Recognition. We all like to have a recognition. Let's just be candid. You feel good when you care for people. And, 30 years from now, you might remember that, yeah, well, I like to have the recognition because I feel good when I do something good and I save a life or I help with the disease process or I battle with the insurance companies to get the latest medication because it was important. Is it financial? I mean, you incur an expense going to medical school and the training. So that is an important component. But again, money will come later on. Right now, you're in a stage where you got to learn as much as possible, as much as possible. To do that, you can't just learn it. I don't know, you're a different learner. I was a learner just to talk about it. So I had to be part of a team and discuss that. I'm sure you guys have been through that. You select your own teams back in the island and you selected, who you're doing rotations with, maybe. But again, all he has to do really, once you're successful and you have the knowledge, and you have all this paperwork out there, because I used to tell my patients, I missed $1 million at graduation, but don't worry about the financial. It will pile eventually with commitment, perseverance, and we'll go into this in a minute. Respect. We all like to have respect from our patients. We want to have respect of our colleagues, and you have to earn that. So that's kind of, um, the logist of being in a medical career. Um, and then again, this is a very key component again, things to think about. What am I willing to give up? You can't have everything. You see, there are three things that always challenge me, and I'm sure will challenge you. Time. How much time do you have? Do I have enough time to sleep? Do I have enough time to do things? So you have to think about, am I going to give up time? Am I going to give up money because I have certain career goals and go in rural areas or go in primary care? You got to be happy with what you select too. And so you see, money is important. And lastly, but not least, family. How about family life? Um, just to project my own, I ended up spending a lot of time, sacrificing family time and spending time. I'm not saying you have to stick by what you feel comfortable, but again, you have to make commitments of volunteerism and do things to excel your career. Uh, the sky's the limit. You remember we said that earlier about 15 minutes ago. Um, and but again, are you willing to pay this particular price? What am I willing to give up? Okay, next slide. So, being your own psych, where do I find belonging? I mean, that's a good question. Uh, you know, Goals, satisfaction, prioritization. These are very important things to think through. And that leads me really to a big one because you have mentors through your career. I remember back in medical school and then, the clinicals. There are certain people that I ticked. We did really well, but again, by volunteering, getting their life easier when you're, a medical student versus an intern who is very demanding, as you guys know, and then of course a resident. You help around, you stick around. Anyway, but you get different mentors even down the line. You're going to become a resident or a fellow. You're involved with mentorships, and that is a good approach. I had different mentors at different stages of my career, and you will too. Um, and it's important. Um, and I have another slide there, that you see. But with mentors, How do you keep in touch with all these people? I used to actually in the graduation, I was privileged to be on the white coat ceremony down in the island last year in January, and and I told him the story, which is really true, from my heart. I used to send 200 holiday cards, 200 holiday cards of different contexts and mentors and people that can help me, people I can call up, because you need to keep in touch with each one of past mentors, present mentors, and potentially future if you're trying to get to the top of the line. I'm sure some of you guys are very competitive, if not all of you. Okay. To get there, you got to have support. To get the support, just like you said, what's in for me? What's in for them? So they like to mentor young students in medicine. We have to have the idealistic components. But again, you have to think about, keeping in touch and selecting the mentors and the pathways to success and happiness, of course. What is success? Is happiness. Another question here is, where do I want to be in X number of years? When I was at Harvard, they gave us an envelope and they said, where do you want to be 25 years from now as your legacy? Let's think about it. And write it down in this envelope in a piece of paper and put it in an envelope, and we're going to send it to you in 25 years. You want to have a legacy. I know right now you say, well, I'm struggling to get through the third year and fourth year and then see if I can get a residency and maybe not, in the more competitive races in a big university system and so on. But I think you can reach all that stuff by planning ahead and and again, review the planning. I mean, once a year I do the planning for the year, but that's on a very high level. On a weekly base, it's purely, what I do on a weekly base. Anyway, all right, next slide. What skills or experience can set me apart as an internist? I'm an internist and I did a GI fellowship. Anyway, because again, beyond clinical knowledge, because people are going to challenge you all the time about clinical knowledge. Personally, even I've been doing this thing now for 32 years. Trying to read on a Saturday or Sunday, as many articles as I can or review things. Although now you can Google up and get a whole bunch of information anytime you need it. But again, that reminds me actually, um, that if you have the knowledge, I remember when I was doing rotations at Brigham and Women's, and ended up the professor I remember in inflammatory bowel disease who wrote the book. He asked me a question, I didn't know the answer, and I kept looking around. I'm sure this happened to you. Nobody would give me the answer on rounds. And he said to me something really wise. He said, well, if you don't know that answer because you have not read or stored it or you heard it in your brain cell, you cannot recall that answer. So just say so. I don't know, and I like to do that. So I want to emphasize again, the more you know, the better you can serve the profession of medicine. And your patients are going to respect you. Your colleagues are going to respect you. You're going to be much more efficient in what you do and how you do it. And I think me as an older physician, I think we lean on young individuals with talent or early career physicians to be able to show that they do the right knowledge and the right thing and enjoy what they're doing, because you got to be happy what you're doing. I mean, I applied in 64 medical schools back those years, and I followed through most of them. And again, I got the opportunity, with Ross to get my education and moved on. I did some research. I got a PhD and ended up, once you have extra credentials, then you can ask for all kinds of things, or you can seek out And I got my training at University of Texas, then bringing a women's Harvard. So, I'm saying I was blessed. And back those years, if it's tough now, think about how was the system back 30 years ago. Anyway, and that's kind of the thing that I want to help you. Each one of you guys can do it. You have to plan it. You have to get the right mentors. You have to have a commitment, and you have to organize. Um, what else I wanted to say? And then I went back to Harvard to get a healthcare management, because again, the more knowledge you have, the better it is. That's what should I pursue additional certifications or fellowships? How will they contribute to my expertise? Absolutely. If you have the time and family, financial, your goals, the more you have, the better you can be from satisfaction standpoint, financial standpoint, contribution to the patients and family. You just have to balance it out, and it's not easy. Anyway, all right, next. All right, so how can I build a strong professional network? That's a good question that you have to work on that. But again, when you look at that, what are the best ways to network in other medical professionals, mentors in the community? I used back last January on the white coat PRNV. It's easy to remember PRN, and the letter V. So let me tell you what that is. P is for perseverance. You must have perseverance in your goals. All right. Without the perseverance, you will not be able to do it. I mean, when I was doing clinicals, I applied to many university hospitals to be able to do my clinicals back then. It was not like it is now, which is a lot different, a lot more supportive. At the university hospitals, this way I would get the best training possible. And, there were a lot of no's, but you know what? I didn't care. I just kept on applying and asking. And that's why every rotation was just another run and a race of medical education. Um, what about PRR? Resiliency. What in the world does that mean? The definition of resiliency, and you heard that numerous times from all kinds of people. I'm not going to bore you with it. But again, a person able to withstand quickly from difficulty conditions, which is resiliency. Okay. Um, I was an underdog. I love underdogs all my career, my life. I like people that they try hard and they're persevering with resiliency. Anyway, I mean, look, fish are resilient of infections. Pediatrics, the kids, the babies, they're resilient a lot more than what the parents give credit most of the time. So, it's there. Now, N is networking. I just gave you little hints earlier. Keep the names, the phone numbers, contacts. You go to different meetings. Make sure that you go to different clubs. I mean, at Ross, we offer several clubs. Are you active involved? Can you go to a meeting when you have the opportunity? Can go to a conference? You learn as much as you can. And again, sometimes there are too many meetings, and you don't remember a single thing. I mean, this is kind of negative here, but I'll tell you, there were a lot of things that I went there and I was exhausted, and you fall asleep. Hopefully, people don't fall asleep today. But I'm just saying, what do you get? At least three concepts that you remember 2 weeks and 2 months down the line. Three. That was my goal, and I'm sure. If you can remember more things, that's even better. But again, down the line, what's the value of that? Anyway, networking. So basically, I sent those 200 cards, holiday time, and I kept the contacts. So when I needed an advice, when I needed something. Now, of course, with the internet, you can send an email. Hey, how are you doing? I hope you have a wonderful day. I'm interesting, to get a letter or interesting in your thoughts on something if you know the person well. And a lot of older physicians, including us and alumni, we love to help people, but again, I offered back a few years ago, and they sent me some papers to review, and they wanted to publish, but then there was not back and forth communication. I mean, I can't do it immediately, but again, the proper time. Anyway, so reach out to the alumni. And that's what we're building, a strong alumni and people that support really you guys, the young people that come in, because we have a huge need of good physicians that are passionate, demonstrated passion. All right. And what else? Volunteerism. Well, this is one way to excel. Because again, you say, well, I got to take my kids to the ball game. Well, take them to the ball game, but then it's sometimes chisel, sometimes so you can do volunteerism. When it comes down to, professional societies, I'm involved with the American College of Physicians, the AMA, the different societies, AGA, it was the Society of Internal Medicine. Anyway, hospitals, once you get to the hospitals, they want residents to participate on that. Again, the other thing is medical societies. At the state of Alabama, I'm just sending something. They need to have a young physician or a medical student or whatever it is. Whatever you are, volunteer, because if you volunteer, whether it's churches, religious type things. I mean, there is tons of volunteer time. If you can sizzle that time, it makes a difference. You make some contacts, you culture those contacts, and be able to excel in the goals that you want to do. You don't do it just for that, but I'm just saying it's a mechanism to get to know people and chisel your skills of communication, goals, and ask for help. I mean, you're not going to say that the first minute, but again, ask if they can help you out, if you give an advice, if they have any contacts. It's funny among my colleagues, always there is somebody that knows somebody who knows somebody that can help. The question is, are they willing to help? And why will they be willing to help? All right. You got to come up with those answers. I can't give you the answers. I don't know the situations. Um, and that happens with prompt communication, to your colleagues, kind and supportive, positive. I mean, we like to complain, especially when it's stressful situations. I'm an extrovert. Someone else can be an introvert. Well, go and exercise. But again, respond within 24 hours. Collaborative attitude. That's a key component, really. I will encourage for you guys to do that. All right. Next, which is huge, actually, mentorship in advancing my career. It is huge, basically. As you guys know, the professors, the community physicians, the different stages you're going through. Reach out politely, but again, you got to be politely and maybe a little bit aggressive, but be sensitive. Okay, if you're too aggressive, it's too obvious that you're just looking after your own interest only. What can you contribute? All right, it's important, but that's how you do that. Mentorship is big to me because again, there is a challenge for individuals that go to medicine nowadays. All those things that people, as a matter of fact, 3-4 years ago was even worse. Now it's getting better as far as the negativity you hear about all the regulations, and it's all about can you deal with all the pressures that goes on. Um, and we'll move on. Next slide, because again, I want to give it time for people to ask questions before I got to move on. So back again, organize, prepare, prepare, prepare. I already told you about my Sunday night preparation for the week, and once a year, whenever you have week off, just gonna spend a few hours thinking about what you want to accomplish that year. If you don't do that and have a plan of action for 2-3 years, you're never gonna get there. So plan it. That's my best advice there. What strategies? I mean, remember the physical, the mental, and spiritual. People talk about, but then we don't have enough time for that. So, I exercise, listen to music, and then I play sports just so I can get, or, the easiest thing is go jogging. hike, whatever it takes. All right, next slide. Um, the key challenge of being a leader in my community, which is interesting, you got to go actually the extra mile, extra time, extra passion, and search for the right mentor. Okay. Um, and you got to walk the path of exceptional service because there are doctors and doctors. You want to be an average, you want to be below average, or do you want to excel? We all want to be the best we can be. Um, Communicate effectively. That's an important component. So these are the things that kind of led me to be, what I was able to get to. Demonstrate the impact of results. That is very important because, again, we can talk. I say I'm the king of England. Nobody will believe me. What are the data? What is the information that I have? Because information is extremely important in the data to be able to convince others to be on your side when there's competitive residencies and so on. I mean, you don't have to be number one, but you can advance through that. All right, forget about the next slide. Let's move on after that because it's already 35 minutes. Um, all right, so what steps should I take to ensure long-term career fulfillment? Um, this is kind of later for you guys, but I put it in there because I talked to other young physicians. Actually, I know you're medical students, but again, hospital committees. Oh, well, I don't have time for that. Well, you're not going to excel then. Some of the practicing physicians, they all want to become chief medical officers. I was there too. Well, you got to pay the price. Like 35 minutes ago, are you willing to pay the price? So hospitals committees, state and national specialty organizations belong that. I mean, conference attendance. I go to different conferences, meet people, see if I can help. I can volunteer. Well, I develop contacts, go out to lunch or dinner when you're there. Again, I do this with ACP, American Council of Physicians. But anyway, academic involvement with university and college faculty. They're always looking for people, and there's no competition. I'm in different faculty, as an assistant professor, but they're not paying me. But that's all right. I enjoy being with students and residents and fellows and some of my colleagues, as professors. So I enjoy that and I volunteer. Do I go there every day? No. Anyway, so I have to chisel my time. Um, some ways to continue evaluate and adjust my goals to stay motivated and fulfilled. Search your passion. Already saying that numerous times. Educate patients and colleagues. Look, the pathophysiology of biochemistry, at some point, you might use it again. It's not just taking the exams and say, heck, now I'm done. Uh, Purely, if you have that knowledge and you recall, it's interesting. And I promise you, there will be years down the line that you're 20 years into whatever you do as an internist or a GI kind of doc. If I explain to the patients the pathophysiology and things that they have questions with, the questions because they look at the information on the web anyway. But again, you gain credibility. You are the top of your game, and that's what you got to do to be at the top of the best institutions and go on from there. All right. Go ahead. The next one. Oh, that's a Picasso. You can look at the difference at different stages of his painting. 1895 versus back many years later. 1964. All right. Next thing again. What you want to do, what you like to do, what I need to do at this point in my life, and define the best work-life integration. It's important. Next, and then let's see here. Well, this is just information about internal medicine, but if you guys are not interested, don't read it. Well, there's tons of opportunities in internal medicine. You can do subspecialty. Um, anyway, you can look at that. I'm sure you're already well aware of all that. And finally, uh, if you have any questions, let me know. But again, I want to say that the last, where is the last? Oh, any questions? Yeah, the last slide, maybe. Yeah, here's my email. All right. Uh, it's not a big group, so you can email me and I'll, give me 24 hours. But it's interesting, you know. I just listened yesterday. The CEO for Apple, there's a new guy, um, and John Ternus. Tim Cook was the CEO of Apple for years and years, and he has $1.7 billion. Blah blah blah. He said, John Ternus says, always assume you're as smart as anyone else in the room, but never assume you know everything that all the other people might know, which is interesting. Just food for thought. All right. Well, we did it in the 39 minutes. So I'm open for any questions that anybody can have.
Doctor, I do have one question for you.
Sure.
There aren't many RUSM alumni who have gone on to do a PhD program. So I was wondering if you could touch a little bit upon the process or like your interest in obtaining a PhD and any challenges that you had going from the PhD program into applying to residency or how the PhD has benefited your career in internal medicine.
Yeah. Well, I wanted to go to the best programs possible, you know, and we're talking about, 1988. Okay. And I started a research program, which led me to think that if I do get a PhD, the information and the training that I get will add probably three times more my credibility uh, when I apply for residency. Um, it's a time commitment. It's a lot of energy. There's a lot of politics in the components. You know, what I'm saying, who is your research committee? How you can do it? Are you going to do it in 3, 4 years? Are you going to do in 7, 8 years? Okay. Um, but again, I was able to accomplish because again, I love learning. Back in high school, I'm sure you guys might heard that in your own life. I was voted as a student that will be all my life as a learning student. Anyway, so that helped tremendously because again, once you had a PhD, they would love to have clinical expertise. Once you pass your exams and you've done well and all the stuff. But again, because then they can use you as a postdoc. So I had choice of the best programs without sound arrogant here. I mean, I interview after that with, I was living in Houston. So I went Houston because it was easier and I got married. But again, I interviewed Johns Hopkins and Mayo, Brigham and Women's down in Florida, Mayo, other programs. And it helped me to go there. Once you go into a good internal medicine program, based on that, grade letters and scores that will enhance you to go to just about any fellowship because again, it's competitive, and back in those years, the individuals that we had to really fight left and right to prove that we come with solid knowledge, we're committed, when underdogs, but don't mess with people that are committed because just back again, the PRNV, all right, resilience, perseverance. So in some of the states, they didn't have Ross graduates in those years. And, you go through all kinds of hoops to be able to get recognized, to get the license, which I got 5 licenses actually when I could, so I can move in any state I wanted to. And I have to wait 6 months or a year, whatever it is in Florida or Texas, as you guys know, California. Anyway, so it gives you an opportunity, but the main thing is you have to have the funding, you have to have the time, and you have to say, what will I do with an extra degree? The same thing with the master's in healthcare management. Harvard has this program. It's a 2-year program. You go back and forth from your job that you have, if they allow you to. And it's 2 years fantastic because then you learn the management and the tricks. And, you know, they'd say in the management, it's one thing. And then you face totally different environments. It's not clinical. It's not military, as you guys all know. The big professor has a bigger saying than an assistant professor who has more saying that a fellow, and then the third year resident versus first year and versus medical student and so on. So it's, and again, nowadays as faculty, I have to take courses of how to speak with medical students. It was not anymore the intimidation we had to go through back 30 years ago. So you see, Alex, the sky's the limit. Each one of you guys, and I know there are 10, 12 here, you know, you can reach that. And there are ways to do it, but again, it takes commitment, hard work, but perseverance, all that stuff that we talked about now for 35 or 40 minutes. You see? Anyway, we can talk more about this thing, but anyway, thank you. Or did I answer? Do you have any other question on that aspect?
No, I think that was great. Thank you for your insight.
Sure.
Does anyone else have any other questions for our esteemed alumnus?
Thank, uh, thank you. I don't have any question. Mine is kind of appreciation because you kind of touched everything. If there's other things that comes up and we'll send you an email, you actually did a very, you covered virtually every area, and you rushed it in 35 minutes. I want to say thank you. We really appreciate it.
Thanks, Andrew. Yeah, we're here actually, and for us, that's what makes us tick, Andrew. I mean, we're there are a lot of people, and Alex can vouch on this thing that on the alumni board, and they attempt to kind of become members. I mean, mentors, and yeah, there is a lot of information. But again, I went to well about 2 months ago actually. They invited me, Seaham and others. They invited me to go down in Phoenix with new students. There were about 22 students, and we had a great conversation. There were some really well established. There was a psychiatrist. There was a nephrologist, Ross University graduates. And I like to build on this even further, where basically, the students that are going to enroll at Ross, students that are in Ross, and that face challenges, so we can have more volunteer mentors, and you guys can reach out and say, well, look, I'm on the fourth year and I want to do cardiology. How do I go and where do I go? You know what I'm saying? Just to give you feedback that we have based on our experiences. Things change. I mean, but anyway. So we're here for you, Andrew, and I'm glad that you spoke out. So absolutely.
Thank you, sir.
Yes. Anybody else?
Alrighty,
Well,
so if there are no other questions, then I'd like to thank Dr. Paslides for his time today and for offering to speak to the future physicians of the world. Thank you to those of you who came and came to the session tonight and listened to what he had to say. I hope this was beneficial. I know it certainly was for me. And I look forward to seeing you all at the next Alumni Council event. Thank you all for coming. Thank you, Dr. Paslides, and
thank
have a good
you.
night.
Thank you. All right.